Hey everybody, it's Jamie here again, and today I'm 3 weeks post-op, which is crazy. I can't believe it was 21 days ago that I was in surgery. The first week just goes by so slowly. Second week's faster, and this past week was even faster. I can't believe it's been a week. I feel like I was just sitting down to make a video before. So what's new? So I have a list of things to talk about, like normal. For starters, since drooling has been a problem in my previous videos, not really drooling when I talk anymore, or really ever. I might have to suck that spit once or twice, but in general, I'm doing a lot better this week with that, and I just noticed that now making this video, so anytime I don't have to slurp back is good. So where are we? Excuse me. So my energy is good. I feel pretty much normal as far as that goes. I haven't exercised or anything like that, so I haven't really tested my energy. And I'm sure if I had a long day, it would make me tired. But I had to go to London, Ontario, on Monday to see my surgeon. So it's an hour away from here driving. And I drove. I just went by myself. And I went shopping afterward for a couple hours, and I drove home, and I felt fine. Like I didn't feel like I needed to lay down or anything when I got home. So, and I certainly wasn't falling asleep when I drove. So that's pretty good. I'm happy with that. I'm sleeping about 9 hours a night, maybe a little bit more, maybe a little bit less. I'm still upright. You can kind of see my wedge pillow behind me here. So that's the more steep side. I have that during the day. So yeah, still sleeping on that, which is I've gotten pretty used to it now. I get myself into kind of a cozy nest at nighttime with a bunch of different pillows around me and a towel, rolled up towel behind my neck so that I'm not, flip flopping everywhere with my neck. The other night I accidentally left it on that steep side like this because this side is like a 90-degree angle, and then of course if you flip it over, it's not. It's a little bit less steep. So anyway, I forgot to flip it over, and I couldn't sleep, and I could not understand why I just wasn't getting as comfortable as I normally am. And it didn't occur to me until, I don't know, it was like 4 or 5 in the morning that I was sleeping on it like that. So when I turned it over, I got a much better sleep. But unfortunately, I had a long day ahead of me after that. So I didn't have as much energy as I would have wanted to. So probably this weekend I'm gonna try going back to normal. Probably I'll sleep on 2 pillows this weekend. I'm going to my husband Anthony's house, and I don't want to bring that wedge with me. It's pretty big to sleep in the same bed as him, so it'd be nice just to lie down like a normal person. So if it affects my swelling badly, makes the swelling go up, I'll probably sleep on some more pillows till I get home. I'll only be there for the weekend, so it shouldn't be too bad, even if it does cause a problem. So yeah, my swelling's really come down this week. You can see. I mean, to most people, I'm sure I look normal. I mean, I can tell that I'm not. I can still tell that I'm swollen, but I'll turn my head around and I'll try to do it slowly. So yeah, still swollen here. I'm not sure. This doesn't feel like it's swelling. This is probably just me being, I don't know, having some fat there, but hopefully that goes away too. So yeah, swollen here. Definitely can feel it here. So yeah, and you can see my profile. So yeah, I've been really happy with my facial changes so far. Comparing old pictures, which you can see on my blog if you click the link before, or link below. I mean, sorry. Really happy with what I look like. My nose looks smaller. It is wider, which I'm still hoping it goes down a little bit. I don't hate it, but it is definitely wider since surgery. My nostrils, you can see they kind of flare out now, where they didn't before. So as far as my bruising, I just have this little tiny dot left here. So it's barely even see it, so I'm not too worried about that. I got away with not very much bruising, so I've been lucky. What else do we have here? Numbness. So yeah, it hasn't really changed in the last week. It's still numb here. It's kind of reduced right here. And then this is numb here. So, and then also my gums and my palate are numb as well. So, which is a weird feeling when I'm brushing my teeth. I tried to use my water pick the other day, and it was just too weird. I couldn't handle it because I don't know. It's hard to describe. It was not good. I haven't tried to use my electric toothbrush yet either. I'm still using the baby toothbrush, so I'm still worried about, pulling out stitches or anything. Although I think they're pretty much gone. I've been lucky with that. I didn't really pull any out. Maybe within like the first week, a few little pieces fell out, but it. So, but I'm still worried that, you know, they're tucked up there, and I don't want to interfere with that with an electric toothbrush or anything. So I've just been happy to use the baby toothbrush. So I'm just going through my list here. See how my lips are still open at rest? I look like this. So I'm hoping that the surgery fixed my lip incontinence when by the time my braces are off and the swelling's gone down. So we'll see. I mean, it's one of those things that you know, they try to fix, but you know, there's not really a whole lot they can do if it doesn't fix. So I mean, it'd be nice not to be a mouth bruiser anymore. I can hold my lips closed now, which I couldn't do last week. See? So that's nice. It's good for eating and talking and drinking and everything. When you can't really close your lips when you want to, then you know, that's when you're drooling and everything. So, but my mouth is still open when I sleep because of, you know, what I look like at rest. So I still wake up every couple hours and have to take a drink from my sport bottle, which is okay. I'm used to it now, but it is getting really annoying. I can't wait till I don't wake up with a completely dry mouth. Let's see what else I have here. So yeah, as I said, eating is a lot easier this week. I take out my elastics, and I use a spoon for most things. My surgeon, I'll talk about my appointment in a little bit, but they said that I can use a straw now, which is easier said than done. This is my less swollen, less numb side, so I had to stick the straw over there and kind of, you know, wedge it closed and suck that way. But yeah, because over here is still numb. So yeah, I've been, like I said, eating pureed stuff. I made applesauce last week. I had blended potatoes. I made blended chicken tacos today, but no tortilla or anything, just chicken and salsa and cheese. And I made a refried bean soup that was really good. And I got these recipes from the book Dinner Through a Straw, which my surgeon gave to me, and I wrote this in my blog for today. But if you don't receive that book from your surgeon or your orthodontist, I really recommend it. It's got a ton of recipes in it. There's breakfast, lunch, dinner, soups, purees, desserts, drinks, you know, really anything that you can ask for. I'm not much of a cook. I mean, I could follow recipes just fine, but I'm not very creative when it comes to, you know, trying to figure out what would taste good blended. So there's lots of different things in this book, and it's good if you're not very creative in the kitchen like I'm not. So yeah, I guess I'll talk about my surgeon appointment. As I said, I went to London on Monday, and I feel like I did already say this already, but he said everything looks good and cleared me to blow my nose and use a straw. And he also loaded me up with elastics. So he put 5 elastics in, which is 3 more than what I had. So you can see I have 4 in right now. 5 is just too much. I know that's what he told me to do, but I can't even open my mouth to talk when there's 5 in there, and it really hurts. And it's also, so the point of all these, you can see they're all going this way, or 3 of them go this way, is to bring my jaw this way, which I talked about in my previous videos. And with 5 in, it was just too much. Like, it was pulling my jaw too far in the other direction, and I couldn't sleep, and, you know, I can eat, I can talk, or anything with it wedged closed. It's just like clenching my mouth closed. So I kind of figured I played around with it, and I took sort of each one out to see, you know, what it left me with. And this combination I have right now, which is exactly what he did, just I removed one of them, still lines up my midline properly, and you know, it's getting the job done without being a huge bother to me. So that's obviously what we want. So yeah, I might try to wear 5 when I get more used to wearing 4, but for right now I think I'm just going to leave it. He did tell me that I can take out the extra 3 that we put in on Monday if I wanted to during the daytime, but put them back in at nighttime. But for the most part, I just leave them in all the time. I know that diligent elastic wear will get me out of braces faster, and that's obviously my objective, so I will wear them as much as I can. So what else? Oh, he also told me that I have to wait till 6 weeks after surgery before I can try eating soft foods again. So that's a little bit of a letdown. I was hoping that I might be able to try incorporating like bread or pasta in sooner than that, but that's okay. As far as weight loss, I've lost about 11 pounds as of today. So yeah, it's a lot. I'm not anywhere close to being underweight though, so I'm not worried about that. I still have to lose off like probably 15 more pounds to be underweight, according to the BMI. So I'm not really worried about that. I highly doubt I'm going to get into that territory. So yeah. My skin here, like in this general area, has been really oily, which sucks. I've been getting pimples. I look okay in this light, obviously, but in natural light, I have a couple pimples around in this area. I use witch hazel a couple times a day on a cotton swab, which is good. I think it's better than using rubbing alcohol. It's a little more gentle. Um, but yeah, it's not really not really helping the pimple situation that much, as far as I can tell. So I've been trying to wash my face a little bit more, just keep the oil off of it. So yeah, but the rest of my skin looks great, which I talked about before, and that's nice. I haven't been wearing makeup on my skin, which is it's a nice change. So I might keep that up when surgery's done, or sorry, when I'm done recovering. Let's see. Yeah, so with the elastics, it has been causing the teeth that they're anchored onto to hurt a little bit, and my palate hurts sometimes. It kind of feels like it's like pulling my jaw down, which is uncomfortable. And I have a TPA, which is a transpalatal arch wire bar thing. It goes kind of up like this in my mouth. That's from having the SARPI surgery. So the teeth that it's anchored onto on either side, those teeth don't have elastics on it, but they're still sensitive. I think it's just, it's pulling everything, and it's really uncomfortable, and I understand why people hate having elastics on. But other than that, I mean, it's alright. And you can see my midline is pretty much where it's supposed to be. Yeah. It's really weird that my teeth are so close together now, I have my whole life with an overbite and an open bite, and now my teeth are starting to sit where they're supposed to be, and it's really weird. Along with that, though, because things are not where they're supposed to be, or not where they're going to end up yet, teeth that really aren't supposed to knock together are knocking together, and that's really uncomfortable. Like right here, this tooth here is always hitting here, and it's a horrible feeling. Ugh, I don't like it. But other than that, I really haven't had a lot of pain. Like, I don't have pain in my jaw at all. Every now and then I get some pain in the joint here, but it's gone down a lot since the first week that I had that pain, so I'm happy with that. I take ibuprofen a couple times a day, once a day, twice a day, one or two, just, for the anti-inflammatory benefits. Excuse me, my cat's trying to get in here. I'm just gonna let her in, or she's gonna keep bugging me. Sorry, and I had no idea how to edit videos either. I tried, and I don't know how to do it, so I'm gonna try to edit that out, but if I didn't, I apologize. So yeah, like I was saying, I don't really have a lot of pain. If I talk a lot or eat something that's kind of thick, like a thick puree that I didn't kind of water down first, sometimes I need to take a Percocet, but I haven't taken a Percocet in a couple days, which is nice, so I still have some left, and I think it's good to have a few on reserve, because you never know what kind of pain might show up soon, and then I wouldn't have any left. But yeah, for the most part, it's completely manageable with ibuprofen, and I don't really have much of a problem. Like, on a scale of 1 to 10, the pain is like at worst, like a 3 or 4, so it's not terrible. So yeah, my last thing I want to talk about was archwire.com is a website that I've been using since I got braces last year. And the really nice thing about that is if you're someone who has braces, or you're going through jaw surgery, or both, you talk to other people that are going through the same thing, have the same problems as you, and so yeah, there's a group of us on there who had surgery this month, and it's been really nice. Or sorry, June. It's July now, isn't it? Who had surgery in June, so it's been really nice to have other people to talk to. And I promised that I would showcase my Canadian accent. So, hi Snap. I hope this video you can hear my accent a little bit more. I'm supposed to say a boot, so I think I had a sample sentence here. Yes, I was asked to talk about having a Canadian accent day. I can't wait till I can have some pancakes with maple syrup, beaver tail, or poutine. So yesterday was Canada Day, and it was really sad not to have barbecue and a couple beer, but I stayed here. and it was good. I didn't have any burgers, no beer, or anything like that. So sad. It was a crappy day weather-wise yesterday, anyway. So I really didn't miss a whole lot, but it is Independence Day this weekend, and my husband is American, so we'll be celebrating that. So I imagine I'll probably have a beer this weekend, but no burger, no hot dog on the barbecue, which is sad. It's hard to go through the summer without barbecue. So yeah, that's about it. These videos are getting longer and longer every week, so I apologize, and thank you for sticking through it if you did. And I'll be back next week with my week 4 post-op video. So thanks for watching.